The state of Washington, with a program entitled the Southwest Washington Child Care Consortium. It's interesting how many child care programs have been finalists this year. And representing that program are Vicki Prendergast and Jada Rupley. Is that right?
Very good.
I've been working on it, Jada.
Thank you. Good afternoon. We are excited to be here to share our innovative program with you, the Southwest Washington Child Care Consortium. What do a school principal, a multinational silicone wafer CEO, and a welfare to work administrator have in common? 25,000 children needing child care in one of the fastest growing regions in the United States. 9 years ago, Southwest Washington community leaders from business, government, and education met to share this growing frustration: adequate, affordable, and quality child care. To address this problem, Educational Service District 112, a regional education agency, together with business and education leaders, made a paradigm shift. We took a business approach to invest in a problem that has typically been a human service issue. A formula creating child care centers for the region utilizing resources from each partner was developed. The common element: each would be established on or near school sites and would be administered by the ESD through the Southwest Washington Child Care Consortium. That may seem obvious now, but there was significant consideration to develop a financially viable program to meet the demand of parents in the workforce and not impact school budgets or interfere with the primary mission of K-12 education. Partnerships between business, schools, and community agencies are the cornerstone of the program, with the involvement of over 30 entities contributing financial and capital resources. We are able to provide quality, affordable, and accessible services to all families regardless of their ability to pay. These services include centers open 7 days a week with extended daily hours with the capacity for 24-hour care, transportation by school bus to and from school, preschool services for low-income children and children with special needs, parenting education classes, child care for sick children, child care for families in drug and alcohol treatment programs, tutoring, and volunteer opportunities for seniors. In addition, we also offer employee training through apprenticeship programs, workshops, and focus groups. This training has decreased our turnover rate far below the industry standard, in addition to creating a career ladder for employees to increase wages as their skills increase.
This program's ability to adapt and be flexible in the meeting of our community's needs has not gone unnoticed. We have been awarded our state's highest honor, the Governor's Choice Award. We have also received other recognition of which we are very proud. A target theme of the innovation program is replicability. Our winning formula has allowed us to replicate our innovations from 3 sites with 60 children to 22 childcare sites of varying size and services. From the Columbia River Gorge to the Pacific Ocean, our program has been replicated in downtown urban Vancouver, as well as the rural community of White Sands, in school districts with over 20,000 students to those with less than 1,500. By using existing school buildings and grounds, we have decreased cost and increased quality. Replication was made easier when we created a nonprofit corporation, enabling us to accept grants and to offer a more flexible salary package for our employees. 9 years ago, we were faced with the challenge of serving our community's most valuable resource, our children. Together, we developed a program that ultimately changed the way government did business by embarking on a mission to provide child care to a community facing a shortage. When efforts to improve the quality of life for family and children are refocused at the local level, the result is a well-crafted web of service, linking the community in new ways. Collaboration can be difficult, but in the final analysis, is a more efficient and effective way of doing business. To quote our State Superintendent of Public Instruction, Southwest Washington's Child Care Consortium will establish the benchmark in our state for addressing the ever-growing need for safe, affordable, and quality child care. It also offers significant assistance in preparing our children for our success in our school system. Today, we stand shoulder to shoulder with school principals, CEOs, and welfare to work administrators in one of the most successful partnerships, making things easier for working parents, their employers, and at the same time, making children feel safe, comfortable, and successful. The Southwest Washington Child Care Consortium was then and is now the right thing to do. Thank you.
Thank you. Questions? Yes, Antonio.
Are you a non-for-profit that gets the majority of its funds from the government?
We are a political subdivision of state government, and we do have a nonprofit that this program works within, but it is a program of Educational Service District, so we're a public agency.
You work within a nonprofit, but you're a public agency?
What we have is we've created a nonprofit for the Child Care Consortium to look at employee benefits, pay,
Okay.
and those issues, but the program is the state program.
Lee Shore.
Help me to understand about how you think about preschool education in the context of childcare. There are a couple of things in the materials and something that one of you said that made me think you think of it as an add-on for special needs kids and low-income 4-year-olds, that it is not a part of the child care program. Would you explain that a little bit?
They are very integrated within that, and I think what you'll find with our philosophy is we don't believe in centers for poor kids and centers for kids that their parents have the income necessary to do that. So they are integrated within the day.
What about,
But
do you
funding.
think of what serves to get kids ready for school as a separate service than providing childcare so that kids are in a safe place while their parents work?
Why don't you go ahead?
No, it's the funding source, that the funding for for children that are in low income families and the funding source for children that are in have special needs comes from a different place, but they're all in the same program.
So that's why you list them separately.
Correct.
But programmatically, they're not
Programmatically, it's
separate.
the same program for all children.
David Osborne.
You mentioned parenting education classes.
Mm-hmm.
Could you talk a little bit about how you do that and how much of that you do and what part, how significant a part of your program that is?
Well, we do parenting education depending on what parents in a specific center need, and so in programs where we have teen parents, we might do programs that are for teen families to learn how to work with their children, and so part of their parenting education is working in the classroom with providers so that they learn appropriate interactions with their children, where we have dual working families who are learning how to juggle the fine act of taking care of activities for their kids and being a parent and work. And so their list of what kinds of things that they're interested in having courses and workshops on is completely different. So we do those inside the day and outside the day during after work hours.
We've also done brown bag lunches at several businesses that our directors from the centers have gone to do with parents.
Yeah. You clearly are meeting an important need in your communities. Can you etch out a little more clearly what the innovation is here so we can all understand it?
I think we were one of those sites that found out when the on-site evaluator came that they could probably articulate that better, because you have two of us that started with this program early on. But I think that as you look at it, what we've ended up with are 22 child care sites and a formula to replicate meeting each community's needs, and yet we have the overarching umbrella of the administrative services and those kinds of things, which then you don't replicate that executive director kind of thing of a nonprofit each time over and over again. And so we feel that we have a cost-effective model.
It's the model.
Mm-hmm.
Please, Susan Schwab.
Could you talk a little bit about your training system for child care workers?
Be glad to. One of the mainstays that we've looked at is an apprenticeship program for our employees, and the apprenticeship program is similar to any registered apprenticeship program for plumbers, pipe fitters, and those kinds of things. And what we've done is we've created what we wanted to see in skills within our employees. What has been wonderful about the apprenticeship program is it is a pretty structured program, which allows people to come in at beginning positions and beginning skills, and then creates a career ladder throughout our centers in terms of today we have directors of our centers who started with us as assistants. We also then supplement those with workshops and focus groups and specific kinds of things to the centers.
Vin Weber, last question.
I just want to, I'm not sure I'm understanding the program correctly, but there still are child care options that are outside of your program in these areas, right? Mm-hmm. What has happened to them and to the availability of alternative options since your program came online?
We still are short. We're the other Clark County in the nation that's one of the fastest growing counties in the nation in terms of we have 35,000 children aged birth to 14. We have 8,000 child care slots with the ones we offer. So there's still not enough care for kids. What we believe we've done is not compete with the private industry. We believe we've raised the standard.
Do they believe you've competed with them?
Pardon me?
You believe you're not competing with them. Do they believe you're competing?
They also don't believe. That wasn't the way it was initially in the beginning. They were worried. I think what they found is that we've created a good standard and good thoughts of childcare in our communities. We've actually brought school-age care, which is not a cost-effective care for a typical private provider to do, into the schools rather than in homes.
Ms. Ripley, Ms. Pendergrass, thank you.